The law expands access to health care to a lot of currently uninsured people. What impact do you think that will have on cost? Did the law do enough to address cost?
Well, let me use the example of the Massachusetts law. I think that when Massachusetts went to a plan very similar to what the Affordable Care Act does, they did the first half, which is they expanded coverage. They really didn't address cost. The Affordable Care Act attempts to address cost through a variety of changes that the federal government first tried to make in both Medicare and Medicaid. And those are things like accountable care organizations, where providers will be responsible for delivering care to groups of at least 5,000 people, and they will be able to share in the savings if they can reduce the cost of caring for that population over time. But you don't, first you have to like meet some level of savings, then after you meet like your 10% or 20% savings, then you get some share of it. Well, that's going to be a really tough way to do that, because those are going to be, you know, pretty substantial changes. Most of what's in the bill are pilots and demonstrations. There's very few actual reductions. There are some reductions related to if your hospital has a higher than expected rate of readmitting people after they've left after an acute care stay. Those are actual reductions. The other thing we do is, just like some of the things on the plans changed as of January 1st, our Medicare rate payments to hospitals were reduced immediately. I believe it was like around April 1st. So we've already started getting back to make our contribution to getting people covered. But we welcome getting people covered. Now, will having people covered, will having a card in your pocket change the cost structure? Are there people out there that have a huge backlog of things that they needed to have done that they haven't had done? I think that's probably true. They are. If everybody that's currently uninsured and over 50 comes into the process and gets a mammogram, that's going to be more expensive. More people will be getting mammograms. Will it be enough preventive care to then say that we're going to catch them all before they have advanced breast cancer, and we find them in stage 1 rather than in stage 3? I don't know if there'll be an offset enough. You know, cancer treatment is expensive no matter what. These are all things that are yet to be seen. And I am, however, on a personal basis, a lot more concerned about bringing people into the system who are currently uninsured. There's not really any magic to buying insurance. If you want health care insurance, put in your age and your gender and search for it on Google. You get a whole 1,000 answers about how you can get coverage for about $125 a month. It won't be very much coverage. But nobody does that. You know, the way you get insurance in our state is you wait for an employer to give you a card. And I don't think that that's going to change overnight on January 1st, 2014. So I'm really worried about getting those folks enrolled so that we can start getting the preventive care, so we can start taking care of people at stage 1 instead of stage 3. Long answer, I guess, but big topic.
Anybody else want to add anything?
I'd love to. I agree. The cost is probably one of the driving issues, if not the driving issue on this. Anytime when you take in children, and nobody's knocking children, I think it's a great thing that we're now going to insure them to the age of 26. But there's a cost to that. You know, let's not kid it. And you go down that list that you were presenting earlier, 2%, 1%. I mean, it's like additions to the children bring home from school. Everything in this has costs tied to it, and it doesn't matter where you are at in the debate on this. I mean, that's why I'm saying we're all in this together. We need to work together in a common solution to try to figure this out. We were really concerned, you know, when this whole debate was going on, we were talking in the back of the room, when they wanted to put the tax on the Cadillac plans. We knew that this thing was sort of getting out of control then, that they were looking for ways to pay this, and it sort of raised a lot of red flags. So this cost issue is the issue, especially with all the funds in this state and across the country. We're keeping a close eye on this, and we've got some huge issues with the cost factor built into it.
I agree with everything that's been said, and we have really pushed for many more delivery system reforms beyond just pilots, but how you would aggressively move for paying for quality versus paying for volume and put them in place. And while there's some pilot tests in Medicare that will take place, we didn't think it was as aggressive as it needed to be, because in the private sector, if you can move Medicare, the private sector can follow, or if the private sector's out there and Medicare comes along, you can make change much quicker. But regardless of what's in the bill, and certainly, as folks have said, there's things that will raise costs, but we are focusing in on at the association. Our CEO is very focused on how do we bring costs down, how do we as the private sector work with partners in our community to do that. And Michigan has some great examples. I mentioned Project Boost, which is working with the hospitals, many hospitals across the community to reduce hospital readmissions. Certainly it improves quality and lowers costs. We have initiatives across the country, and we've developed what we call lasting operational solutions. And we've also just launched development labs where we're testing, we're working with Harvard and independent entities to test what's working, what's bringing down costs, what's improving quality, and then spreading it across. So while we don't think the bill went far enough, we as a system have said we're going to make sure that we're aggressive and working with our partners. So I think there's steps we can all take. It's hard, it takes time, and it involves everyone. We have to work with our hospitals, with the providers, with pharmaceutical companies, because everyone has a skin in the game of how we bring it down, and we're committed to that.